Hi, this is Terri. Welcome back to my channel. Recently, I had my annual exam with my primary care doctor, who I actually like a great deal. We've known each other for a while. He plays tennis. He's about the same age. His kids are about the same age. And I guess it's as close to an old school family doctor relationship that one can have in the current healthcare in America situation. At the same time, for being incredibly healthy, there are a lot of moving pieces. And I was totally overwhelmed today when I was going through the list of appointments and follow-ups and vaccinations, etc. And, I even have everything on an index card that I put together at the beginning of every year, and it's still overwhelming. I'm pretty good about keeping my every 6-month dental appointment with my friend Carliza. It gives me a chance to catch up with her. Her dental office is actually quite lovely. My annual dermatology exam with my doctor, who's also through Palo Alto Medical Foundation. I like her. I like catching up. So it's that's actually a decent relationship and not terribly hard to keep up with. Where I've really struggled over the last, 10 years, 15 years is finding a good gynecologist. If you've read my book, Piloting Your Life, you read the story about how frustrated I was that my gynecologist did not know I was going through perimenopause and knew nothing about the menopause transition. So my primary care physician referred me to somebody within Palo Alto Medical Foundation. I saw her last year. She doesn't believe in hormone replacement therapy. She's limited availability, and I actually didn't really feel like I was heard when I talked to her. And of course, there's always the conversation about my weight, but never really a discussion about how that ties into perimenopause and menopause. So that's always truly frustrating. With regards to the gynecologist, I recently started seeing somebody through Midi Health. It's one of the telehealth, virtual health menopause transition providers. There are a couple of them out there. I've even invested in one, Electra Health, and she got me on to hormone replacement therapy or menopause hormone therapy. And for the most part, that's taken care of hot flashes. It's taken care of some of my joint pain. Still waiting for it to take care of the weight issue and then also my sleep. But I'm optimistic that we'll get somewhere with that. But in my appointment with Midi Health, because my dad had breast cancer a couple of years ago, she said, even though it's on my dad's side and not my mom's side, that I'm still at risk. And even though I don't have the BRCA gene, she still wants me to have, I think, a 3D imaged mammogram, which I will schedule. And this time I'll go through Palo Alto Medical Foundation because that's all that they do. I think she wants an x-ray too, but I'm not sure that I'm going to get that at this point. I'm not sure what my insurance is going to cover. And I've already spent the last almost year fighting one miscoded bill and getting 6 months getting another one resolved, which has held me back from reaching out to my retinal specialist for my twice-a-year follow-up from when I had a macular hole and then ultimately cataract surgery a couple of years ago in my left eye. I need to get that one scheduled now. I think Thursday's going to be a really fun day for scheduling appointments. Also trying to understand what my immunization status is, because sometimes I'll get some immunizations or vaccines through Rite Aid or CVS, sometimes through Palo Alto Medical Foundation, and then my COVID stuff is all over the place. The only way I can see it in one place is if I send the records, usually by fax or by mail or handing it to my doctor, to get it into my Palo Alto Medical Foundation records, so it's all centralized in one place. I really just cannot believe that in 2023 we don't have a simple way for us to own our whole entire healthcare and medical record. I think Apple's trying to do it, but I looked in there and not everything is in there, so it must not all be completely connected. At 50, I opted to do Cologuard instead of a colonoscopy, and the box for my 3-year follow-up is sitting right here taunting me in my office, and I think I will also be taking care of that sometime in the next week or two. It's not always a fun experience to deal with, but I think it's better than having to deal with the prep and the actual for the colonoscopy, from what I hear from all of my friends. But I'll get on top of that one as well. for the amount that I pay for insurance, medical insurance for me and the kids, Zeke's on his own plan from being a retired police officer, we should have like concierge level service for all of our healthcare. All of our healthcare records should be in a single place. This should not be that complicated, especially since I'm healthy and have relatively few issues to deal with. It's really mostly just maintenance and preventive type of diagnostic stuff, but it should be a lot easier. And I'm very frustrated by how overwhelming it is to really manage it, how expensive it is, and then trying to deal with it for the kids as well. Yes, I'm whining. I should be very fortunate or feel very fortunate that I even have access to healthcare. I should be very grateful that we're all pretty healthy. And I guess what I want to say to all of you is now is the time to take good care of your health in midlife. If we are not doing it now, we are certainly not going to be positioned well for the future. So find trustworthy healthcare providers. It might take a couple of times and some persistence to do it. Get the labs, go in for the mammogram, get the colonoscopy or do the Cologuard or whatever the latest technology that you and your healthcare provider feel comfortable with. Just take care of yourself. You are absolutely worth it. You deserve it, even though it can be scary and it can be overwhelming. Trust me, I can totally relate to both of those. And finally, advocate for yourself. If something doesn't feel right, if something does not seem right, definitely follow up, ask the questions, ask somebody else to take a look at it, or ask for a referral to another healthcare provider. Once again, you deserve it. And with that, I'm going to go ahead and let you schedule those appointments and then actually go to those appointments. Don't be like me who schedules, schedules, and then cancels, because part of it is scary, part of it is time consuming. But take care of yourself. You're worth it. And with that, let go of perfection, take some risks, and above all else, have some fun.